I'm so happy to introduce my next guest at the Infinity Podcast, the special edition of TAMC 2025. Someone very dear to my heart, someone who's a great friend of mine, someone who's one of the German legends of dermatology, one of the German legends of the aesthetic world and teaching. But really, she's not German. She's actually Croatian. Welcome, Tatjana Pavicic.
Thank you so much.
Welcome, Tati. And even though we could speak in Croatian, we're going to speak in English for our podcast. It's a real pleasure to have you here. You've been with us since 2019. You've been at TAMC since our second TAMC Congress. You are part of the scientific board, the driving force behind the scientific content. It's because you are a driving force, I think, generally in aesthetic medicine. How did that happen? How did you get into aesthetic medicine?
Actually, by coincidence. You know, I never wanted to study medicine because my parents are in medicine and we all don't want actually to copy our parents, or we want to copy our parents like you. So basically, when I finished the school, my Matura in Germany, I could decide, I was not sure, medicine, because my marks were very good, or economy, or actually chemistry and engineering. And I thought, I'm too pretty to go for an engineer. And the students, the male students, are mostly not so pretty. For economy in Germany, actually, it's enough if you have a Mark 3 and don't have to have a 0. I said, okay, let's do medicine, do 10 years plastic surgery, and then go to hospital management. That's how I started.
That was the plan.
That was the plan originally. And then after, I think, like 3 years, so pre-clinic 2 years, and the first year's clinic, when I had my 3 internships already in plastic surgery and a general surgery, I was always said like, oh, where is that little blonde girl? What? You are going to assist me? Yeah, it's still a male domain surgery. I said, no, that doesn't make sense. That's not what I want to do. But I was still interested in aesthetics and the plastic surgery. So basically what I have done actually in my 5th year of university, I went to Etikon. That was just acquired by Johnson & Johnson. And for 3 years, I did marketing and telemarketing internship. So actually, I know everything about sutures, Vicryl, Monocryl, Ethibond, and all of that. And then basically, I had to finish the last year in Germany of the university is just a clinical year. So I said, okay, I'm going to do a surgery and internal medicine. These are obligatory. And as my optional 4 months, I said, okay, let's do dermatology. Dermatology, you get out at 5 p.m.
Easy.
It's not like surgery. It's very close
rashes.
where I lived. I can take a bicycle and go there. And then I really fell in love with dermatology. And I was in the largest hospital for dermatology back then, 168 beds of Ludwig Maximilian University, with the famous dermatologist, Professor Braunfeig, Professor Plewig, who introduced Roacutan and his isotretinoin with Professor Kligman. So he was my first teacher.
Wow.
And I loved it because actually the station where I was more about autoimmune diseases, you know, really sick people, really people who need help. And then basically, that's how I stay in dermatology. And after 1 year being a resident, they said, actually, they don't have a space for me.
Oh, really?
So I said, okay, what should I do? And I contacted someone who was already approached to become a new head of the department. But in the meantime, I went for 6 weeks to Shanghai and in another office management internship for the guy who actually brought Bertelsmann Book Club to China from Germany. And then I came back after 6 weeks. They had a position for me. And then the new head of the department came, Professor Ruzicka, in the end of 2005, beginning of 2006. And I was in residency. And he said, I want you to make aesthetic dermatology department for me.
Oh, right.
And before that, we were not even allowed to speak A of aesthetics. So I started like everybody, you know, back then, 2006. What were I doing?
Bit of Botox,
a little Botox, a little bit of nasolabial.
Nasolabial, yeah.
Thanks God nothing happened back then.
We were doing with a needle, no cannula, not thinking about anatomy.
A little bit lips, a little bit perioral lines, and all of these patients with elastosis, they all look so...
I know.
I don't know why, but never something happened. We know now about all the risks. We didn't know anything about the anatomy. And this is how gradually it started. As we were at university, I had a chance to do international clinical studies. So this is how I very, very quick, I think already 2008, started doing teachings in Germany, 2009, all over Europe. And actually, I think it was in February 2010, I had a chance to go to Cosmetic Update.
Okay.
Our meeting is cool, but this was the coolest meeting ever.
Where is it?
Cosmetic Update was organized by the Canadian plastic surgeons and physicians, dermatologists Novel Solish and Chantal Sopra.
In Canada.
And actually, they always looked for a beautiful place, somewhere Riviera Maya, Mexico, or something like that, or somewhere in Caribbean. And they invited 30 best aesthetic physicians, plastic surgeons, dermatologists from US and Canada, and 5 from abroad. I don't know how, but I was the lucky one.
They recognize the star.
Obviously. So this is how anti-aging started. This is when I first time met Michael Caine, and we had a long toga party. I should not remember.
Oh my God, don't tell us anything about
or
it.
Or Stephen Dayan or Arthur Swift and all of these. And this is actually, I think this is a unique opportunity in aesthetic dermatology or aesthetic physicians. If you have a good network, you really have a chance to learn new things. And you also have a chance to become really soon and very quick, because we are still not that standardized, like in a surgery. In a surgery, before you have your residency, you have to finish, 150 surgeries. In aesthetic medicine, it's all up to yourself. You can train yourself, you can connect other doctors. And back then, there were only 20 leading people in the world. So if you write an email, can I visit you and come for one day? They all would say yes, because there were not so many international colleagues visiting each other. Now it's a different situation.
It's a different situation. Ray Hayawas earlier on in a podcast was saying, well, that is what's great about TAMC. It is a network, he says. And Jonathan Sykes said this, there are people he's friends with now, he's connecting with. And I think our speakers, and I think largely thanks to you and Tapan, we have an incredible bunch of the top doctors, which any Congress, even any Congress in the world would be proud of. And all the doctors who I've been speaking to today say the same. And I think you should be very proud of, because you're one of the brainchilds of this. And I think we can grow this and grow this. But let me ask you we can come back to TAMC, about aesthetic medicine. Where has it gone? We've had a strange period recently on TikTok and Instagram. Facelift suddenly. Oh, Kris Jenner looks amazing. I think a lot of this is just doctored videos and doctored.
She didn't have just the facelift. She didn't just have it.
Exactly. She had resurfacing and all sorts of stuff. Yeah. But it's not only that. But suddenly the filler was the bad guy. Oh my God, it migrates, it lasts forever, and so on. Of course, I still think it's the best thing in the box that we use. But where do you think aesthetic medicine is now? Is it combination treatments? What do you think of biostimulators? Polynucleotides? Do we have enough evidence for those? Where do you stand on all the different treatments we have now?
I think there are treatments that really have a very, very solid base, evidence-based data for multiple clinical studies, in injectables, in devices, in lasers. Some are quite new, like exosomes, for example. Yeah. I always tell to all the colleagues.
What do you think of those?
To be honest, I'm a close friend with Tun Shiriaki, who even has his company, and the other colleagues like Steve Cohen. For me, all the studies that I've seen on exosomes are always at the wounds, eczematic skin. And as a dermatologist, I have to speak about the skin barrier. And if you have a cream or something that needs to penetrate to an intact skin barrier, we need to perform studies and collect data on intact skin barriers. And a burn skin, a wound, or eczematous skin, they don't have intact skin barrier. So therefore, I'm a little bit careful. And these things, if they have a huge potential, but if the potential would be really applied to fully, I'm not sure if we can easily control that. So I think the combination treatments are definitely the future, and that's what should be the presence. My MMITP, multi-layered, multi-model, individualized treatment protocol. But why? We are doctors. And as doctors, the first thing that we should do, not only in the classic medicine, but also in aesthetics, is to assess our patient, to examine our patients, and establish a diagnosis. And this is something that I think went wrong in the future. Patient is coming, seeing some treatments on Instagram. Oh, it's a trendy. I want to have that. Even if it doesn't
And doctors
fit.
give it to them.
And the doctors are giving. I said, hey, come on. I remember when I was at the outpatient department of dermatology, and I would prescribe, steroid cream. And the patient would say, hey, you're just prescribing steroid cream. You don't want to know what I really have and where my allergy is coming from. And in aesthetics, patients ask exactly the opposite of the classic medicine. They want us actually to be a shop seller. And I think I haven't studied for 6 years and then have 5 years of specialization in dermatology and all these years of experience. I listen to my patient, what they want. But I think in the end, we have to make a decision and based on the medical terms and then actually choose the best treatment for each and every patient. Trends comes and go. We see that in fashion.
Exactly. But tell me, and this is very important, you are a real authority in all of this. You're one of the people look to. You are on the board of IMCAS. You're on the board of everything, I think, in the world. But you have your own teaching academy, right? Can you tell me a little bit about that? What do you want to teach? Do you teach anatomy? Do you teach injection techniques? Do you teach how you use your devices? Or is it like a holistic teaching experience?
Actually, there are different courses. It's called Beauty Masters. So basically, but the cornerstone is the anatomy. So basically, my favorite course that we offer is the cadaver course. But not just the cadaver as anatomy, but I said it's beautiful to know the anatomy. But if you can't apply to the living patient, it's useless. It's just the knowledge. So basically, we combine it in a one day. We have a cadaver. So where I would, a day before that, dissect half of the face and then first introduce all the different layers. Then I would perform injection on the different areas and dissect. And then the participants inject on little cadavers themselves and then can dissect and really see, oh, am I close to the facial artery? Or what is also nice, if you have 7 specimens, anatomy in all 7 of those is different because we have a cadavers where in arteries, the red silicone is pre-injected and in veins, blue silicone. So it's very easy to recognize it. If you don't have these injections, it's quite difficult, even for very experienced anatomists. And sometimes you really have these oh my gosh, I was injecting for so many years with this technique.
So close to this
artery. See how close it is. And the next day, it's really a hands-on. So really what you have learned on patients. Exactly. So because I think this is a really transfer of the knowledge. And of course, we have sometimes like a one day, something specific if you want to learn about combination treatments like periorbital area. And I think that needs to be really focused on a very small areas because there are so many information. If you want to combine lasers with injectables or energy-based devices, you need to have people who are very experienced already with this kind of treatments and then just to bring all them together.
That's why anyone who's watching and hasn't booked TAMC 2025, of course, this will probably be aired after this Congress, they have to come and see Tatjana Pavicic, not only at TAMC, but also Munich, because the pearls of wisdom, the gain to gain, are unrivaled. And I think maybe next year we should do a pre-Congress training course of your academy, possibly combined with TAPS. We can do something incredible. But tell me, there's something else I really want to ask you. You and your wonderful husband talk a lot about management of clinics and also AI and the future of it. And I know you're using AI more and more for everything. Earlier I spoke to Michael
Kane. You gave me even some lectures last year and this year on AI.
On AI, and I think it's an incredible future. I don't think AI is quite at its potential yet, but I think we're using it already quite a lot. We have some really innovative sessions which Tatjana and yourself have put together, sort of difficult cases and debates, and also a section on the future of. And I've got a lecture. I didn't want to do too many lectures this year. I've got too much work with organization of the Congress. So I'm doing a lecture of new toxin, the future, the new toxin. You've got a really interesting talk, and we can talk about it because this will be aired after the Congress. So people will be, you've got new stuff. What is that? What are you going to be talking about?
Basically, I'm speaking about artificial intelligence and how this is going to change aesthetic practice in 2035. So I can just say it's either utopia or dystopia, or it's a balanced or realistic expectation. And I really believe it's unavoidable. There is just going to be, for those who say, no, I don't want to use artificial intelligence in any way, I think they're lost, basically. We see it in other parts of medicine, where we use robotics, or just recently, I know in Johns Hopkins, they performed abdominal surgery without doctor, just a robot. Seriously? Yeah.
Abdominal surgery?
Abdominal surgery, I think this was cholecystectomy. And it was without surgeon behind the robot. In Munich, they have in the University Hospital Da Vinci. I know you have one in Croatia with Milojevic, actually.
There is, exactly.
And they are using it for 10 years now. I even have patients who had surgery with that. So I think our patients are very open. And I did a little survey with my patients the last 3-4 months when I was preparing that talk. And I said, what do you think if in the future there would be like a robot arm and is injecting you? And you know what my patient said? I said, as long as you are there and having time to chat with me. And I think that's also a chance for us, and especially maybe also for the patients and for the aesthetic business. Because why, for example, fillers are now having such a bad reputation? Because some of our colleagues do not perform assessment and examine the patients. They just inject where they have seen some
Instagram photograph or whatever.
Instagram photograph, or inject everybody the same, so people look the same.
It's not the filler's fault, it's lack of knowledge.
It's lack of knowledge, and it's also ignorance. And I think we have to still have a perform conscious medicine, because we are doctors, and maybe even more than if you have sick people, we have healthy people who just want to look better, be more confident. So we have higher responsibility. And maybe there is a chance that artificial intelligence in the future, what I call MMITP, you have a photo, you have a patient, and you have tools that would help you to perform these assessment and examination quicker, because we all have to work quite quick and earn money, or sometimes we are just impatient. And if we have these tools and we implement them in our future clinics, I think that's good for us, because this would increase our satisfaction. It would increase patient satisfaction. And what is important, and this is the difference between utopia and dystopia with artificial intelligence, if we can learn artificial intelligence to respect uniqueness of every human face and the identity of each human face and personality.
And because what I have to talk about here, I think aesthetic medicine is not just science. You're one of the most published doctors in aesthetic medicine in the world. I mean, if not the most published, I don't know, we'd have to count. But we have to be artists.
Yeah.
So we have to be artists. We're sculptors. We're not just it's not just anatomy. It's not just, we need to also look at the face like a sculpture, and we need to nurture that. And I wonder if AI can do that. Can AI be artistic one day? Maybe they can.
It can. I mean, we know they already have their. Last year, I had a chance to meet Julian Van Dieken, who is the first guy actually that made an AI art, the girl with the pearl earrings, that has been exposed in the museum. He was at my son's school. Very cool guy. He was originally children's photographer. And when I look at that piece of art, I mean, how is the art defined? It's in the beauty is in the eye of the beholder. That's what we say.
Exactly.
But I think that's the way for us to teach AI.
We have to teach it to make imperfections, because I'm worried AI is just going to make everything too perfect. And we are not perfect, and we are beautiful because we're not perfect.
This is what I said. If we teach the eye to respect the individuality, the uniqueness, and on the other side, at the same time, this is also the risk of AI, to have the uniform beauty. Yeah. But let's be honest, we have colleagues that inject everybody the same. Exactly. We already have these risks.
We do.
So maybe AI would even help us to clean
that up. Do you think AI could help us? We talk about longevity at TAMC quite often as well. Do you think AI, because like Michael said, it's a faster search engine in a way. He's not convinced by AI yet, and he talks quite a lot about that. But he thinks it is a faster way to do research. So because if we can research illness and things like that more quickly, is longevity going to really be there? Is AI going to help us live longer?
Certainly it will. I think to take something out of my talk on 2035 tomorrow, I think it's going to be like a melting pot. Aesthetic medicine and longevity and regenerative medicine, they will be together. Or which part is going to be more, I'm not sure. Is it more artistry? Is it more longevity? It's the healthiness. But I think that's why we are here. I mean, it's not only how old you are on a paper, but how old people feel. And most of our patients actually feel younger. They are fitter, they are more vital, and they just want to look the same way like they feel. I don't want to look like 25 any longer. I had my big slavia cheeks.
You do look like 25 today.
Thank you. And I think this is how AI can help us, but it's also our responsibility and our role to control and teach AI. Yes, AI learns much faster. Yeah. And this is what this surgeon who performed this first soul robotic surgery said. That robot now was like, maybe a doctor in a residency. But the AI can learn much faster than we can. If it takes 5 years from a resident surgeon to become experienced surgeon, AI does it in 5 days, probably, maybe even quicker. Depends on the capacity of the processor in the background. And I think this would be a missed opportunity for the humanity. And I mean, there are different documentaries, The Future of Humanity or something like that, where you have these 3 scenarios. Either the humanity is doomed, or we are going to learn to control the AI and use it or abuse it. That's political decision rather.
It is. I mean, Harari, he's one of the experts on AI. And he says that if we talk to other countries, and if countries globally develop AI together, then we will learn and we will control AI. And I think it's a wonderful future. If we're going to be developing AI separately in different countries, which is kind of happening at the moment, one day AI will control us. I don't know if that's true or not, but
it could be. I mean, it's a really good documentary. I think I watched it on one of the planes. And I think the ideal is the balance and the melting between humanity and all that is our strength, the individuality, the uniqueness, the empathy that we have. At the moment, and I think that's the last thing that AI is going to be able to learn, empathy. And to being unique. And I think that's also for us physicians, as long as you are unique and you do something that your patients really appreciate, that they love, that they see not just a doctor that is performing a lip filler for 500 euros, but they see you like Nicola and like to come to you and chat.
Exactly.
We are safe and we are going to probably work together with AI, but we will still be there.
We have to be there, Tati.
We have to be there.
Now, I have to ask you for the end. I asked TAPS these questions. Quick fire, either or, which one do you prefer? Botox or fillers?
It's not or, it's and.
And, okay, Botox or fillers, great. Polynucleotides or exosomes?
Polynucleotides yet.
Microneedling or blood plasma?
Microneedling.
Laser device or a HIFU device?
Microfocused ultrasound with visualization and lasers.
I think that's enough. Tati, tell me, what are you expecting for the next 3 days of TAMC? What are you expecting this year?
Actually, if I should put it in one word, firework. Firework of science, firework of fun, firework of new information and connections. Meeting friends, it's like a family coming together. And I saw some of my friends today in the morning met already on the plane. I met already some people on the plane when I was coming in. And I think it's like a getting big family back together, like a family gathering. At least once a year here. Yes. And mostly we meet somewhere in the meantime
as well.
Somewhere else.
Thank you, Tatjana Pavicic. You are incredible. Without you, nothing would be the same. I hope we carry on with our friendship and our collaboration and with TAMC for another 2,000 years with the help of AI. Hope we're here. I hope your wonderful husband who's walking around as well is always here looking so young as well. Thank you, Tati. Guys, that was the incredible...
That's a secret of good wife. The husband has to look good as well.
Without a good wife, the husband is nothing. I have to say that. Incredible Tatjana Pavicic, the legend. If you're not coming this year, if you didn't come this year, then come next year to see her or at her courses. Thank you, Tati.
Thank you, Nicola.
Thanks.
And the patient was said, hey, you're just prescribing steroid cream. You don't want to know what I really have and where my allergy is coming from. And in aesthetics, patients ask exactly the opposite of the classic medicine. They want us actually to be a shop seller. And I think I haven't studied for 6 years and then have a 5 years of specialization in dermatology and all these years of experience. I listen to my patient what they want. But I think in the end, we have to make a decision and based on the medical terms and then actually choose the best treatment for each and every patient.
And we are not perfect, and we're beautiful because we're not perfect.
This is what I said. If we teach the eye to respect the individuality, the uniqueness, and on the other side, at the same time, this is also the risk of AI, to have the uniform beauty. But let's be honest, we have colleagues that inject everybody the same. Exactly. We already have these risks.
We do.
So maybe AI would even help us to clean
that up. Do you think AI could help us? We talk about longevity at TAMC quite often as well. Do you think AI, because like Michael said, you know, it's a faster search engine in a way. He's not convinced by AI yet, and he talks quite a lot about that. But he thinks it is a faster way to do research.
But we will still be there.
We have to be there, Tati.
We have to be there.
Now, I have to ask you for the end. I asked TAPS these questions. Quick fire, either or. Which one do you prefer? Botox or fillers?
It's not or, it's and.
And, okay, Botox or fillers, great. Polynucleotides or exosomes?
Polynucleotides yet.
Microneedling or blood plasma?
Microneedling.
Laser device or a HIFU device?
Microfocused ultrasound with visualization and lasers.
I think that's enough. Tati, tell me, what are you expecting for the next 3 days?
But we will still be there.
We have to be there, Tati.
We have to be there.
Now, I have to ask you for the end. I asked TAPS these questions. Quick fire, either or. Which one do you prefer? Botox or fillers?
It's not or, it's and.
And, okay, Botox or fillers, great. Polynucleotides or exosomes?
Polynucleotides yet.
Microneedling or blood plasma?
Microneedling.
Laser device or a HIFU device?
Microfocused ultrasound with visualization and lasers.
I think that's enough. Tati, tell me, what are you expecting for the next 3 days of TAMC? What are you expecting this year?
Actually, if I should put it in one word, firework. Firework of science, firework of fun, firework of new information and connections. Meeting friends, it's like a family coming together. And I saw some of my friends today in the morning met already on the plane. I met already some people on the plane when I was coming in. And I think it's like a getting big family back together, like a family gathering. At least once a year here. Yes. And mostly we meet somewhere in the meantime as well. Somewhere else.
Thank you, Tatjana Pavicic. You are incredible. Without you, nothing would be the same.